Hello everyone, now let us discuss about 2023 changes in the CPT coding guidelines for special ophthalmological services. These come under the chapter medicine under the subsection ophthalmology. Now coming to the changes that have occurred in the 2023 in this particular topic. Two changes have been done. The first one is an existing code was revised and the second is a new code was added. First, we'll discuss about the new code. The new code added is 92066, which is nothing but ortho-optic training under supervision of a physician or other qualified healthcare professional. This is new code. Coming to the revised code, it is 92065. It is ortho-optic training performed by a physician. The newly added code is under supervision of a physician, and the existing revised code is performed by a physician or other qualified healthcare professional. And it was previously only ortho-optic training. And now it is revised to ortho-optic training performed by a physician or other qualified healthcare professional. For supervision, you need to code 92066, which is a new code. When the physician himself performs the ortho-optic training, you need to code 92065. Now coming to the CPTs, the first one is 92015, which is nothing but determination of refractive state. The next CPT is 92018, ophthalmological examination and evaluation under general anesthesia with or without manipulation of globe for passive range of motion or other manipulation to facilitate diagnostic examination complete. For complete test, you need to report 92018. And for limited test, you need to report 92019. The next CPT is 92020, which is nothing but gonioscopy. Gonioscopy is an eye test that checks the signs of glaucoma. It is an eye test that checks the signs of glaucoma. And the CPT is 92020. The next is 92025, computerized corneal topography, unilateral or bilateral with interpretation and report. The next is 92060, sensory motor examination with multiple measurements of ocular deviation. For example, restrictive or paratic muscle with diplopia with interpretation and report. The next is 92065. This code we have discussed earlier. This is a revised code that is indicated by triangle. Ortho-optic training performed by a physician or other qualified healthcare professional. The next is the new code, which is indicated by circle. 92060. Under ortho-optic training under supervision of a physician or other qualified healthcare professional. The next is 92071, fitting of contact lens for treatment of ocular surface disease. The next is 92072, fitting of contact lens for management of keratoconus initial fitting. For the treatment of ocular surface disease, whenever we fit the contact lens, you need to use the report the code 92071. And whenever fitting of contact lens is done for the management of keratoconus initial fitting, we need to report 92072. The next is 92081, visual field examination, unilateral or bilateral with interpretation and report, limited examination. Example, tangent screen, autoplot, arc perimeter or single stimulus level automated test such as Octopus 3 or 7 equivalent. This is limited examination. For limited examination, you need to report 92018. For intermediate examination, for intermediate visual field examination, which requires at least 2 isopters on Goldman perimeter or semi-quantitative automated supra-threshold screening program, Humphrey supra-threshold automatic diagnostic test, Octopus program 33. These must be included. The CPT is 92082 for intermediate visual field examination. For limited visual field examination, the CPT is 92081. And for extended visual field examination, the CPT is 92083 and it must include all the listed isopters. The next is 92100 serial tonimetry with multiple measurements of intraocular pressure over an extended time period with interpretation and report on same day. The CPT is 92100. The next CPT is 92132 scanning computerized ophthalmic diagnostic imaging anterior segment with interpretation and report. It can be unilateral or bilateral. Bilateral 50 modifier. The next is 92133 scanning computerized ophthalmic diagnostic imaging posterior segment with interpretation and report unilateral or bilateral optic nerve. And for scanning computerized ophthalmic diagnostic imaging of retina, you need to report 92134. For ophthalmic nerve, the CPT is 92133. And for retina, for scanning computerized ophthalmic diagnostic imaging of retina, the CPT is 92134. The next is 92136. Ophthalmic biometry by partial coherence interferometry with intraocular lens power calculation. The next is 92145. Corneal hysteresis determination by air impulse stimulation, unilateral or bilateral with interpretation and report. Now let us see an example here. An established patient has a comprehensive exam. The exam is comprehensive in which she has been diagnosed with dry ocular surface disease in both eyes. Patient is diagnosed with dry ocular surface disease and the ophthalmologist measures the cornea for the placement of soft contact lens for treatment of this syndrome. Here, fitting of contact lens is being performed for the treatment of ocular surface disease. And that is done for an established patient who had a comprehensive exam. So, 2 CPTs must be reported by the ophthalmologist. The first is 92014 along with 25 modifier to indicate comprehensive exam, established patient, 1 or more visits. Followed by 92071 to indicate the fitting of contact lens for treatment of ocular surface disease that we have discussed earlier. Here, the ophthalmologist is fitting the contact lens for the treatment of this syndrome, which is nothing but dry ocular surface disease. 25 modifier is indicated to indicate a separately identifiable procedure has been performed on the same day. So, 92014. Along with 25 modifier and 92071 are the appropriate CPTs for this scenario. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.